Let's turn to someone who's been on the front lines treating coronavirus patients in California since the start of the pandemic. Let's bring in Dr. Mark Morocco, professor of emergency medicine at UCLA Medical Center. Dr. Morocco, thank you for talking with us this morning.
Good morning to you. Thank you for having me.
Absolutely. So let's take this a step at a time. The restriction Miguel just mentioned, including closing in-person dining, hair salons, even outdoor playgrounds. In your opinion, was all of this necessary?
Well, the numbers don't lie, and the virus doesn't care whether you're a Democrat or Republican, you live in Orange County or Los Angeles County. We have so much of the virus in the community here in Los Angeles, and this is true nationally as well. In my column, I wrote, the virus is a fire and we are dry grass and it's burning from sea to shining sea, and those hotspots are everywhere. So all of the things that we could do in the summertime and the early part of the fall, because we were so successful with our initial response in Los Angeles and in California in the spring, all of those things are different now. There's so much more risk that you will contact somebody who has the virus, is spreading it, and doesn't even know. I use this simile. It's like one of those zombie apocalypse movies. The zombies don't know that they're zombies. They're just out there. The chances of you contacting those people while you're at a restaurant, even socially distanced, while you're getting your hair cut, are much higher now. So this is a real time, an opportunity the next 6 weeks to do it again. We didn't expect to win this war with a single battle, but now we are really in the battle for this entire epidemic. You must do something. You must do something in the next 6 weeks. What you do matters for your family, for the country, for the people that you don't even know that you're saving.
So, Dr. Morocco, there in California, you've got the most cases of any state in the country. Why are the numbers there heading so badly in the wrong direction? And what are the emergency rooms and ICUs like right now?
Well, Al, I think everybody feels the same fatigue. We've been doing this for 7 months. And to put it in perspective, it feels like we've been doing it forever. But compared to something like the Great Depression, which was 10 years, World War II was 5 years, we are just in this sort of, and the last flu epidemic in 1918 was 2 years. So we're kind of in the beginning of this. I tell people all the studies that we're doing, all the things that we're learning, it's a little bit like trying to predict the final score of a baseball game in the third inning. We're kind of almost halfway there. So all of the hospitals in Los Angeles County, very diverse county, lots of different kinds of hospitals, big university places like where I work, little community hospitals. There's a very, very big difference in the amount of resources that are available. But we've all been preparing because we saw these numbers coming. We knew that this would happen if we had trouble with folks losing their focus, if you want to think of it that way. In a coaching metaphor, we want you to stay in the moment. Like, this is when you make the big play, and they're simple plays. We're not asking you to do anything crazy. Protect your family, stay at home, mask, wash your hands, avoid big crowds, try not to travel now, right? We just need a 6 week focus until these vaccines come in and give us the sort of light at the end of the tunnel. But until that time, all of us in emergency medicine and critical care have been preparing because we could see that these numbers were possible. They're actually worse than we thought were possible.
Wow.
Dr. Morocco, you did mention that Pfizer's vaccine is likely to be the first greenlit by the FDA for use in emergency use. But that light at the end of the tunnel, so to speak, I mean, we are still in the tunnel right now, right? So we can't just know that having a vaccine in the future is going to solve everything in this moment.
But one of the things you should remember, and I tell folks, you have to forgive yourself a little bit, right? You have to understand that this is difficult in many ways. People are feeling alienated. They feel sort of sad. There's certainly feelings of depression. But there is a light at the end of the tunnel. But it doesn't mean that we're done yet. But I tell people to focus on the simple things that they can do, to gather their family around them, be in a safe place, do the things that you can do together that are low risk. And for now, there are less of those things than we had before. But there really is, each stepping stone is a single action. What you do matters. Stay in the moment. Stay focused. We get through the next 6 weeks. The rest of it's going to be a lot easier. Now, remember, once these vaccines come into the community here, and we think we're going to get our first doses in the next week or so, there's going to be a while until people get their immunity up. And then those doses have to work their way out through the community, and that's going to take a few more months. But once we get to the point where so many people are vaccinated that herd immunity can kick in, we should see this thing end relatively quickly. But we have to get to that point. And that's what I'm telling people now. Just stay positive, stay focused, No matter what you think about what's going on, this is a time for all Americans to unite. We've done it before. We can do it again.